So I'm just going to be doing my med pass on my patient Edna Cleaver, so I'll just refer to her as Ms. Cleaver. So reviewing her past medical history, she has hypertension, coronary artery disease, AFib, type 2 diabetes since 65. She also, let's see, she's had thrombotic stroke, possibly related to AFib. She's had a CVA with right hemiparesis. She's 72 years old. And then for some personal preferences, she likes to take her medicine with applesauce because she has a difficulty swallowing pills. She has all her fluids thickened to nectar, and she also complains of severe nausea and refuses to eat breakfast. So right now we have a couple of orders because we're going to be doing some med administration. We have 200 milligrams of Emeradone, which is PO daily, Lisinopril, which is 20 milligrams oral daily, warfarin 5 milligrams oral daily, DocuSodium, which is 200 milligrams oral daily, and Humalog insulin, which is on the sliding scale. And let's see, and for her particular case, she's gonna be in the range of 6 units because she has a 258 blood glucose level, because we're on that sliding scale. So first I'm just gonna start with the beginning, which is I'm just gonna check the order against the MAR, which I just did. Do my 6 rights. I'm gonna make sure I have the right dose, documentation, drug, as well as the right patient, the right route, which I kind of stated previously, and the right times, which all of these should be given at 8 o'clock. I also didn't mention actually the Zofran as well, the 4 milligram IM injection, which should be given 4 hours as needed. But it also says that previously that she's been experiencing some nausea, so we need to kind of quell the emesis. So moving on, I'm just going to move on to some med prep. So I'm just going to make sure I do my second check, which is checking the medications against the MAR. Since I have the MAR right here, I'll just place this right here, and then I'll move on to making sure I have the right medications. And I don't know if you guys want us to like use the actual ones. I just have the 4 oral meds just at random, but I understand like if it's the right dose, then I use the right dose. If I need more, I need more. Alrighty, so for example purposes, I have 200 milligrams of Amiodarone, so I check it here, make sure it's the right dose, check it right there, should be the same, which it is. Do the same thing with the Lisinopril, 20 milligrams. With the warfarin, it's 5 milligrams, this is also 5 milligrams. The Colace, which is 200 milligrams, and this is also 200 milligrams. So I'm fine with these. I'm just going to place these into a cup so I can administer them. Moving on, I'm just going to set up, let me do some hand hygiene before I start touching all these parenteral medications. And then I'll put on some gloves. Oh, and prior to like actually like putting these meds in, I also have to do the calculations. None of these require a calculation except for the Zofran. It says that it's stated for, we have an order for 4 milligrams every 4 hours, and the vial is 2 milligrams per milliliter. So I'm just gonna be giving 2 milliliters. So moving on, I'm just gonna start with the insulin. So I'm just gonna take this off, get my alcohol swab. I can actually put that there now. I'll swab the top of the vial. Perfect. And then I'm gonna be using the insulin syringe and needle. It's what we're given. We need to have exactly 6 units. So I chose the one that goes up to, I believe, let's see, it says it in a different unit. I think this one goes up to 50. It's just the smallest one that we have, so I'll take it out. Got cap. And then I'm just gonna draw on that 6 unit. Get all the air bubbles out. And then waste the excess until we exactly hit the 6 unit mark, which is perfect. And then I'm just going to recap. And I can do this because I'm not sticking this into anybody, so it's not contaminated and it's still sterile. I can toss that. And then to the Zofran, which is going to be our intramuscular injection, I chose the, let's see, the 3 milliliter syringe with the 23 gauge. That's usually the standard range that we use for gauge of needles. And since we only need 2 milliliters, I think 3 is perfect. So I'll take this out. I can toss that there. Get my alcohol pad. Swab the cap. Take out the needle, and then we can draw the medication up to the 2 milliliter line. Let's see it again. Perfect. Get any air bubbles out. And then I'm just gonna waste all the way until I have to. Not a lot, obviously, but just enough to get me perfectly on that 2 mil line. And we're perfect. Let's see, there's my cap. Just going to recap prior to administration. Cool. And to get a sterile needle, I have a second one right here. I'm just gonna swap these out because I already used it, stabbing it into the vial. Cool. That's that. And on top of that, I'm also going to make sure I write on the vials and I know exactly which medications are which. So I write the dose, the drug, the name, everything that I need to kind of document it. And I believe that is it. So now that I'm done with med prep, I'm going to take this off real quick since I kind of already used it. Cool. And then we can go in to the patient's room. Prior, we're just gonna walk in, we're gonna do some standard protocol. So I'm gonna say, hi, my name is Cameron, I'm gonna be your nurse today. I'll provide some patient privacy, wash my hands again, put some gloves back on. To make sure I have the right patient in front of me, I'm gonna ask for their first and their last name, their date of birth, and I'm also gonna check their wristband just for redundancy. And once I get that, should be good. And then moving on, I want to do my third check, which is checking the medication against the MR again, but just in the patient's room. So again, I'm going to be stating, all right, Miss, we're going to be administering your amiodarone 200 milligrams. Is that, current? And then we do that so on and so on for the lisinopril for 20 milligrams, the warfarin for the 5 milligrams, the Colace for the 200 mils, the Humalog, and then the Zofran since you're feeling nauseous. And then on top of that, We could do some patient education for the amidone. I believe it's for the arrhythmia, and we want to make sure that there's a regular pulse. So I'm just going to make sure that her pulse isn't too low or too high. So in between the 60 to 100, right at her apical pulse for 60 seconds. For the lisinopril, we're going to be doing checking, I believe, her hypertension. So making sure that she's not having any excess bleeding, usually like around the lungs, or not lungs, her gums, any unusual bleeding. Moving on for the warfarin, that's an anticoag, so we're gonna make sure that, that she isn't having like too thick of blood, or her blood isn't too thin and she's again like bleeding too excessively, and that's just for her stroke. And then onto the DocuSync, I believe, or the Colace. Yeah, for the Colace, that's just gonna be a laxative, and I think that just has to do with the combination of the other medications, as well that she's like sedentary and she can't walk, and that her mobility is really low. So we're just gonna do that as well. With the Humalog, we're gonna be making sure we're like checking for any signs and symptoms of hyper or hypoglycemia, because we're regulating her insulin because she can't do that currently. And then again, I kind of explained the Zofran for that nausea, which she's been experiencing. So yeah, that's going to be our third check within the patient's room. So now I can get into administering the medication. Alrighty, so I'm just going to start with the oral medications. And she states that she likes to have this with applesauce, so get that to her, and make sure she doesn't aspirate, and that she's like breathing properly because she has difficulty swallowing pills. So give those to her. And then moving on, I'm gonna start with the Humalog with the sub-Q injection. So right now I'm just gonna choose the site. I'm gonna choose the abdomen. I think that's the usual site. And usual protocol is 90 degrees. If I can't pull like less than 2 inches of skin, then I hit a 45, but for the case in point, I'll do a 90-degree angle with a pinch. So first, I'm gonna grab the alcohol, swab the site, get the medication. There we go. Alrighty. Then I'm just gonna pinch the skin and then inject the medication. And then instantly put it into the sharps, but I don't have a sharps container, so I'm just gonna recap it over here. Perfect. And then apply some gauze. If I had any gauze on me, just right there. Perfect. On to the next one, we're going to be doing the intramuscular, which is that Zofran. Alrighty. So choosing the site, I'm going to do the ventrogluteal. So I'm going to be placing my palm on the greater trochanter, making sure my fingers are going across the iliac crest, and that my thumb is pointing towards her groin. So I'll have her sitting on either her left or her right side, just based on preference. And then from that, since I have the site, I can get my alcohol swab. Perfect. Then we're just gonna pull the cap. And then we're going to be doing the Z-Track method. So I'm just going to stretch the skin, and then I'm going to administer. Perfect. And then I would immediately put it into sharps, but since I don't have a sharps container, I'm just going to recap it for the time being. And then apply gauze. And then that's probably the conclusion of the administration of the medication. So right now we would just do some documentation, setting the patient back up into their bed, making sure that they're all good. With documentation, I am going to be crossing off each medication that I provided to the patient, and then putting my initials. So we did the amiodarone, the lisinopril, the warfarin, all at 8 o'clock even, the Colace. We did the insulin at 8 o'clock with the 6 units, because we're on that sliding scale. And then we also did the Zofran, so I'm going to write 0800, my initials, cross, and then at the bottom we have the signature for the RN. And that's it. That's the conclusion of med administration.